Have you ever been ripped out of a deep sleep by a sudden, stabbing pain in your leg? One moment, you're resting peacefully, and the next, you're bolt upright, gripping your calf in agony, wondering if the pain will ever let go. If that sounds familiar, you're not alone. Millions of people, especially those over 60, deal with the same nightly torment. Night leg cramps aren't just painful, they're frustrating. They interrupt precious sleep, and they can cast a shadow over your entire day. If you're watching this, chances are you've had enough. You're tired of being jarred awake by that searing pain. You're tired of rubbing your leg in the dark, trying to will the pain away. And more than anything, you're ready for relief. In this video, you're going to learn 2 simple techniques that can stop nighttime leg cramps in their tracks. Fast. They take less than 2 minutes to perform and require no fancy equipment, no special supplements, and no medical knowledge. They're safe, easy, and effective for people of all ages, but especially helpful for those in their 60s, 70s, and beyond. But don't stop there, because toward the end, I'll also share 2 bonus strategies that can make a world of difference in preventing cramps before they even begin. These are things you can start doing tonight. No more guesswork, no more sleepless nights, just better rest and a better tomorrow. Let's begin by understanding the problem. Leg cramps, especially at night, are more common than most people think. In fact, 1 in 3 adults over the age of 60 deals with them regularly. These cramps usually strike the calf muscle, although the feet and thighs can be affected too. The pain is sudden, sharp, and overwhelming. You might feel the muscle tighten into a rock-hard knot, and no matter how much you move or massage, the tension can last from a few seconds to several minutes. There are no medications specifically approved to treat this issue. Many over-the-counter solutions make bold claims, but don't address the underlying tension in the muscles. That's why physical relief, through specific movement and stimulation, is often the most effective path forward. Let's get into the first method, massage. Now, this isn't your typical spa-style massage. It's a targeted, do-it-yourself approach designed to release tension deep within your calf muscles. Best of all, you don't need another person to do it for you. Here's how it works. Lie on your back, on a bed, couch, or even a soft carpeted floor. Once you're comfortable, bend one knee and gently place the calf of your other leg on top of that bent knee. Your kneecap becomes a convenient massage tool. Begin to slowly roll your calf muscle back and forth over your knee, applying gentle pressure. Use small strokes, like you're smoothing out a wrinkle in fabric. You'll probably notice 1 or 2 tender spots. When you find them, slow down and give those areas extra attention, maybe 6 to 10 more strokes. It's perfectly normal if one leg feels tighter or more sensitive than the other. We're all built a little asymmetrically, and our dominant side often carries more tension. Don't try to fix it all in one go. This isn't a sprint, it's about consistency. You're in full control of the pressure. If anything feels sharp or uncomfortable, ease off. This should feel like relief, not punishment. The more frequently you do this, the more your muscles will respond. Over time, that knotted tension begins to melt away, making those nighttime cramps less likely. Once you've massaged one leg, switch to the other and repeat the process. This can be done right before bed, when you wake up, or even during a midday break. It's quick, it's simple, and it works. Now that you've released some of the tightness, let's stretch those muscles out with the second technique, ankle flexing. This is more than just pointing your toes. It's an active stretch that wakes up your lower leg and reminds your muscles how to move fluidly. Lie back again and stretch your legs out. Start by pointing your toes downward, like you're pressing on a gas pedal. Then, pull your toes back up toward your head, flexing the ankle. This up and down motion creates a dynamic stretch that lengthens the calf muscle and reduces the risk of sudden cramping. Don't rush through it. Do this slowly and mindfully. Point and pull, point and pull. If you haven't done this in a while, you might feel a bit of a pull in your arches or even your toes. That's normal. Your muscles are simply reawakening. If lying flat is uncomfortable, feel free to place a small pillow under your head or knees for support. You can also perform the stretch one leg at a time, 10 to 12 repetitions on each side. This movement is especially useful if you wake up in the middle of the night with a cramp. Instead of panicking, go straight into this ankle movement. It often disrupts the cramping pattern and brings relief much faster than passive waiting. Let's recap quickly before we move on to the bonus tips. First, use your opposite knee to massage your calf muscle with slow, steady strokes. Second, flex and stretch your ankle by pointing and pulling your toes. These two techniques, when practiced regularly, can dramatically reduce the intensity and frequency of leg cramps. But we're not done yet. Let's talk about 2 more habits that can make a big difference, both of which you can start tonight. First, take a look at your bedding, specifically how tightly your top sheet is tucked in. It may sound strange, but tight sheets can restrict the movement of your feet and calves while you sleep. This forces your muscles into awkward positions, especially if you're a back sleeper. When your toes are pointed downward for hours, your calves can tighten without you even realizing it until they cramp. The solution? Loosen your top sheet. Make sure there's enough room for your feet to move freely. If you can flex your foot comfortably between the sheets, you're good. This small change often brings big relief. Second, consider applying a topical magnesium cream or oil to your calves before bed. Magnesium is a mineral that helps regulate muscle function. When applied directly to the skin, it can penetrate into the muscle tissue and help relax tight areas. Many people with recurring leg cramps are surprised by how much better they sleep after adding this simple habit to their routine. You don't need a prescription, and it's generally very safe. Just test a small patch of skin first to ensure you don't have a reaction. Massage the cream gently into your calves in the evening, ideally after your stretching routine. There's one more thing to be aware of. Certain medications and medical conditions can contribute to leg cramping. If you're taking medications for high blood pressure, cholesterol, or fluid retention, such as diuretics, beta blockers, or statins, these can sometimes increase cramping as a side effect. And certain health conditions like diabetes, kidney issues, or circulation problems can also make cramps more likely. So if your cramps persist despite these techniques, it's worth bringing up with your doctor. Rule out anything more serious and make sure your treatment plan supports muscle health. Let's review everything once more. Use your knee to give yourself a deep calf massage. Stretch your ankles by pointing and pulling your toes. Loosen your bed sheets to allow free movement at night. Try a magnesium cream to relax tight muscles, and if needed, talk to your doctor about medications or underlying health concerns. Night leg cramps don't have to rule your nights or your life. With a few minutes a day and a little consistency, you can take control. You can sleep better, move better, and feel better. You've already taken the first step by being here. Now take the next one. Try these techniques tonight. Set a reminder if you need to. Your legs will thank you, your sleep will improve, and you'll wake up feeling refreshed instead of frustrated. Thank you for watching, and may your nights be peaceful and pain-free.